Hi, I'm Dr. Edwin WIlliams. I'm a facial rejuvenation specialist based in New York with a clinic in Albany and St. Thomas. I'm here really to talk to you today about fixing scars after a botched facelift. I don't really like the term botched, but I do see a lot of patients who have unfavorable scars. And in fact, what I tell patients is if you can see the incisions or if you can tell someone has had a facelift, it's probably a facelift that's not done well. So we really should not be able to see the incisions at all in someone who's had a facelift. That's really what I define as poor scars. Now, they should be completely hidden so that the hair grows through the incision and tucked around the contours of the ear. And if you get on our website, you can see what the incision looks like. But basically, there are a few different causes for a poor scarring. One is that there are some individuals, and this is very, very uncommon, who just make cheilites. They make a hypertrophic scar. And I see that about every 6 months or so in a very busy facelift practice. It's typically behind the ear, someone who's trying to make a little bit of a scar, and we get very aggressive with treating them with laser and steroids, and they're most of the time we're able to take care of them and settle them down. On rare occasion, maybe once or twice a year, we have someone we have to actually redo that one incision behind the ear. But typically, believe it or not, I don't know why it ends up being behind the ear is the most common place. Thankfully, it's not in front of the ear. The most common reason, in my opinion, professional opinion, that you see a poor scar or what we call a botched incision is from inexperience. Poorly placing them, either in front of the ear or not irregularizing them or going behind the ear. We do have another video showing what a deep plane facelift incision is like if you want to check that out on our website. But that's the most common. Or closing that incision under tension. The way we do our deep plane lift is we do a deeper muscle suspension, so there's absolutely no tension on the incision. And then when you tailor those flaps in the precise location, they don't widen. And so to me, that's one of the most common. Poorly placed and tension on the flap. Fixing them, fortunately, is easier than you would think, because what I typically do, you're talking about someone who's had a previous lift. As they continue to age a little bit, and more recently, a few months ago, I had someone who's just 9 months out, but was so unhappy with her incision, I went back and did another lift. Here's the bottom line is, when I do another lift, I'm able to release things, get a little more lifting out of it, and place those incisions where they need to be. Timing, ideally, I like people to wait a year, but I've done it in less than a year on a patient, so we're able to, again, basically take their own tissue, take out that scar, and then fix the scar and put it in place. And by the way, they get the benefit of another lift out of it. So I hope that answers your questions. We have a lot more information on our website, and I hope you found this useful. Thanks for watching.